Good morning, my special people. Good afternoon, good evening. According to your time, that's why I take the greet now today. I don't come again. Thank you all for subscribing. Thank you for tuning into my channel. And if you're just tuning in for the first time, don't forget to subscribe, turn on the notification bell so as to be notified each time I post a new video. And don't forget to like, share, and comment. And also, if you are already my subscribers, if you have been following me up from the beginning, I want to say thank you. I really appreciate you guys. And you're welcome back to my channel. Today matter so, although they write out from English, but I feel like to speak pidgin because I did hear some rumors say that my English too dey many or it too dey plenty. So I'll just try to blend it with pidgin English. But even if it gets to the stage that I happen to read with English, do pardon me because it's written in English, okay? So I bring you the news update, okay? Lovely people. You know I'm doing it for all of us, okay? So back to why we are here. Coronavirus will delete Yemen from maps all over the world. That's what they talk about. I get videos to Yemen, an Asia country, in case you don't know. The special report now talks say virus don't compound Yemen humanitarian crisis. It can talk now say the impact when the coronavirus don't get for Yemen don't they devastating during the years of civil war. The head of the United Nations Refugee Agency for the country don't tell Sky News. According to Yemen capital Sanaa, Jean-Nicolas Boueze said the number of the suspected COVID-19 cases within the country now don't they appear to be multiplying fast, and at the same time, international aid agencies they are forced to abandon critical programs. The coronavirus now, he said, if it is straw which will break the camel's back in Yemen. Mr. Boueze say via one video link. He said it don't be very difficult for the public health authorities, despite all the effort where they try to track this spread of the coronavirus. He said they don't even get enough tests, they're not even able to do enough tests. He said half of the health facilities for the country don't they destroyed by 5 years of conflict. People don't die for many other causes, too much as dengue fever, malaria, cholera, and different sicknesses, and even the war itself considering the virus. Then the UN now don't they warn us say as don't they want with Sky News. They say as the film now with the footage for the southern city of Aden showing live upon line of graves as authorities they cope with the growing numbers of death. The way the death rate they spread no be my mind. The way people they die like just they die like say that na chicken, human being. See how they bury them. I will see the video. Numerous diseases now still there already. The endemic for Yemen now and the years of the civil war now don't displace millions of the citizens for that country now. They don't displaced. Most of them don't lost their houses. Most of them maybe they don't lost their parents. Now only they don't offer, or maybe husband lost his wife, or maybe wife lost the husband or children. You get. There are more than 24 million of the citizens now, which is about 80% of the population, don't they in need of humanitarian assistance. Half of the country now, the health facility don't they dysfunctional. Not the work again. Health facility, their hospital, they work again. And nearly a quarter of the country's districts have no doctors. Nearly a quarter of the country's districts have no doctors. We know now and say the immunity among the population now they're very, very low. And we talk here about people who maybe eat once a day. They speak about children who maybe they're not even vaccinated, because normal if you born children now from small, that they give them vaccines from baby. They never give them vaccine to say maybe they stop them from contacting all these kind of different viruses or different sicknesses. They not get the vaccine. They can't be exposed now to all this kind of thing. Imagine how it can be. Also now the Mr. Bones say he go to speak about people who don't fled from their country. They don't run, they fly come off for their country. That's what they fled from their homes, because their homes now were sheltered or bombed due to the civil war. they fit throw bomb boys or maybe gunshot. All of them are done for them. And therefore now they not gonna get any other means of livelihood. Imagine they not get house, they not get roof over their head, they not fit even afford to eat more than once. That one step now manage if they go even see the food eat. Secondly now self maybe they don't dey displaced out of one, don't they be orphans, some don't be motherless, or don't be fatherless. You can imagine. We just pray may God save this country. We just pray may God save them. Because it's not that easy. Watch the video.
In Yemen, they have become used to burying their dead. There is something procedural, almost emotionless about all this. And yet it is different now, because the numbers these past few days have soared. They don't know for sure that it's corona. No one is testing. But there is an anticipation, holes and space for many more. And there's a hopelessness too. No one here seems to be taking any precautions. This is a cemetery in the southern city of Aden, a place those in charge here have now described as infested. I buried my mother here the day before yesterday, this man says. And look now at how many graves have appeared since. This graveyard will soon be full while more bodies keep coming in. The roads out of Aden tell the story of this country. 6 years of civil war, and behind the destruction, displacement, disease and famine. The world's worst humanitarian disaster. It is a phrase associated with Yemen for so long, it no longer seems to resonate. And yet, add now to this, corona. 120 miles northwest of Aden, inland, is Taz. This is a divided city, split up between all the warring factions. At what they call the hospital's isolation centre, there are blood tests for those who turn up unwell. It is basic stuff. Cholera, dengue fever, malaria, all are here, all for as long as the war, and with spikes this time every year. It's the rainy season now, and with that, in a country like this, disease thrives. This is Sana'a in the north, Yemen's capital, and the Houthi rebel group's stronghold. At the city's main hospital, Dr. Hamdan Bajare shows us around.
In general, we haven't any sufficient solutions seriously to face this struggle. Just only like that. And how we can face this struggle, I don't know. We haven't any facilities, we haven't any material totally sufficient. I said sufficient, that means to face this struggle, to face this disaster, we haven't, just only have this.
Since this was filmed just a few weeks ago, it's now not possible to get into the hospital. The authorities in control in the north won't allow access. But it is clear from those we've spoken to on the ground that the intensive care unit is now full and the mortality rate is near 100%.
The coronavirus may be the straw which will break the camel's back in Yemen.
Jean-Nicolas Bouze heads up the UN's refugee agency in Yemen. For him, it's not just the immediate problems, but the knock-on as squeezed donor countries pull their funding.
We have received not even 30% of the funding while we are close to the mid-year. And therefore, we have to prioritize our intervention. We will try to see what kind of program can be saved, but honestly, within a few weeks, those programs will entirely stop. So we will be leaving 3.6 million internally displaced and 280,000 refugees without any form of assistance. It's a life and death situation for them.
And here they are, filmed this month, some of the families who will soon have their aid reduced or removed altogether. In Yemen and well beyond, corona is impacting directly and indirectly too. Still, even among this hopelessness, or maybe because of it, we found remarkable ingenuity.
Hello everyone, I am Loita Ahmed Al-Mahbashi.
A medical engineer in a dusty room turning what looks like junk into makeshift CPAP machines, those breathing devices that have saved so many lives globally. And at a desk, wires are bound together to make thermometers.
Even the simple things in my country, simple equipment, simple device that we can like discover the coronavirus or something like that, we don't have. I told you it's going to be a disaster if coronas enter Yemen.
The hope is that he's wrong, but these images and the figures behind them over just the past week are grim. Mark.
Just see the video. I love verify and plan myself. So another one again now. The state now for here say new report highlights various dimensions to farmers, herders conflict in Nigeria. Like I say herders, all those people they follow cow or sheep or goat, herdsmen. The violence now we don't dey for Nigeria, the northwest, to be precise now, don't dey rooted in the intense competition for land. They don't dey drag land, like say they drag land between the Hausa farmers and the Fulani herders. I mean Fulani herdsmen. May not appreciate the English. Can't did one kind. Herdsmen as the same thing as herders. So both of them now don't they respectively demobilize vigilantes and bandits. They don't they go they carry maybe they mobilize maybe small youth. Don't they learn how to they fight, or don't they learn how to they shoot gun, or don't they learn how to they against each other? Imagine fellow human being. We'll continue to the read now. He talk now say the coming report now, don't they talk now say the report by the International Crisis Group is due for release next Monday. I don't go release it. Identifies the effect of climate change, the proliferation of small and light arms, demographic explosion is spreading violence, as the herders are involved in violence with farming population in the Middle Belt and further south. So are they with Hausa farming groups in the northwest, commonly regarded as the core north. This perspective now may help improve the understanding of the herder or the farmer. The herder and the farmer conflict in Nigeria as one not essentially rooted in any ethno-religious expansionist agenda, but competition for resources in the context of ecological degradation and unchecked population growth. Ethnicity and religion as well still dey weak, and weak governance too may have only drawn out the conflict and had made a solution really possible. So due to all the bad amenities, maybe so we don't even get the basic amenity, ethnicity where they cause some the governance they weak, or the ethnicity they with the religion they weak, everything about them now just they weak. Ask me how they want to take up with this thing. Anyway, the picture that I still get to show now, still see, and I swear if they bring more updates, I'll see that to know or how they work out for the issue. Sure, now understand, not trust me. This one again, not the same Nigeria. Insecurity that they talk about. Insecurity. The Nigeria Air Force don't deploy more troops for North Central. The Nigeria Air Force now don't deploy special force to address the insecurity wey dey for North Central zone for the country. Governor Abdullahi Sule, who don't receive the troop for the Lafia Cargo Airport on Monday, he don't thank President Muhammadu Buhari for a response to the security situation wey dey the zone. The governor don talk now say the Lafia Cargo Airport no go now serve as the operational base for the Nigeria Air Force 22 Quick Response Command for the Central Zone, while e dey pledge now say e support to the troops wey dey don serve. Earlier, the chief of the air staff, Air Marshal Sadiq Abubakar, don urge the troops to be professionally conduct when they do their best according to the profession wey they don train for. They urge them now to be professional and uphold the core of the Nigeria Air Force, where value integrity, service before self and excellence in all you do, he said. Abubakar, who was presented AVM Charles Owu, the Air Officer commanding Special Operation Command, don tell the special force say they were deployed to complement and add value to the already existing security. In the chat, tell them now say see where una come you. No, your head say they send them come to come add more value to the existing security apparatus wey don dey ground before. Then the Kosi talk now say you must cooperate with operation wide stroke. You deployment not only for Lafia but for the North Central. Na him talk. The Air Chief appreciate the state government for the assistance in the establishment of the 22 Quick Response Wing for Lafia. Another picture to show you. I still get another photo now to show una, but before I go show una, I tell una wetin dey inside the content. Say President Muhammadu Buhari on Monday now don hold a virtual meeting with representative of the Nigeria Governors Forum and some government officials. The meeting now they hold am for in attendance for the Nigeria Government Forum chairman Kayode Fayemi, as well as Governor Simon Lalong of Plateau and Sokoto Aminu Lambuwa. Other governors at the meeting now still include David Umahi from Ebonyi governor, Ifeanyi Okowa Delta State governor, Babagana Zulum Borno State governor, and Mohammed Abubakar Jigawa. President Buhari presided over the meeting from the council chamber of the State House for Abuja, the nation's capital. In the chamber with him was for the chamber when they I don't see speak another English. Na pidgin I be talk. The chamber na person we follow under this chamber na of a chief of staff Professor Ibrahim Gambari, as well as the secretary to the government of Federation, Boss Mustafa. The Minister of Finance don budget national planning Zainab Ahmed, and the governor of the Central Bank of Nigeria Godwin Emefiele also attend the meeting. This meeting comes as the federal government is expected to review the 2 weeks of ease of the COVID-19 lockdown and possibly adjust its strategies to curb the spread of the disease. The coronavirus pandemic has taken a huge toll on the country's cash flow, necessitating a review of the medium-term expenditure framework (MTEF) and the 2020 budget. Now the picture now be this one. Another update. The UN chief don renew call for COVID-19 solidarity as World Health Organization don warn majority of world still at risk. Wetin tell them? For here now, don dey say addressing World Health Organization, member states attending the first shortened and virtual World Health Assembly for Geneva via video conference. The UN chief don point out say despite some solidarity, there had been very little unity for the global response to the new coronavirus so far. Because he talk now say because of this one now, a microscopic virus don bring us to our knees. He still talk now say before reiterating his support for the irreplaceable World Health Organization. In the advice now say many countries don ignore the recommendation of the World Health Organization. The UN chief still talk say as a result, the virus don spread across the world and don dey move into the global south, where its impact no go dey more devastating and go dey risking further spikes and waves. Likening the sometimes contradictory strategies adopted by countries to a global failure to address climate change, Mr. Guterres repeated his call for more nations to address the pandemic health impact and economic and social fallout. Unless we control the spread of the virus, the economy will never recover. Now wetin he explain. Support was needed that we keep households afloat and businesses solvent. The UN Secretary General also insisted reiterating its call for the G20 group of nations to consider launching a stimulus package equivalent to a double-digit percentage of the global GDP. He also called for greater support through the International Monetary Fund, the IMF, the World Bank Group, and other international financial institutions. Now, the first I continue to read that it's long. That's what the video said long. But I show now the little one when I forget from it because I need to, they show now more details, they show now proof. Here comes the video.
Good afternoon, good evening. Your Excellencies, Honorable Ministers, Ambassadors, Delegates, Director General, in my capacity as outgoing President of the 72nd World Health Assembly, I am pleased to welcome you all to this virtual platform. Now let us turn to the high-level welcome. I have the pleasure of giving the floor to Madame Michelle Bocos, Director General Envoy of Multilateral Affairs, to facilitate this session. Madame Bocos, you have the floor, please.
Thank you very much, President. Your Excellencies, the World Health Assembly is the biggest event on the global health agenda. Each year, thousands of people, including health ministers and high-profile personalities, converge in Geneva to discuss issues of global importance, ranging from health security to universal health coverage. This year, we are meeting in a virtual platform. Nevertheless, the spirit of togetherness that characterizes the Assembly is still with us. Au nom du Directeur Général, le Dr.
In the name of the Director General, Dr. Tedros, it is my honor to welcome world leaders who have been kind enough to agree to participate in this historic de minimis assembly with us. I shall invite the first of our 8 high-level guests to make her statement as the representative of the host country. Your Excellency Simonetta Miriam Sommaruga, President of the Swiss Confederation, you have the floor.
Monsieur le Président.
Thank you, President, Director General, ladies and gentlemen, ministers, Your Excellencies, delegates. The crisis that all the member states of the World Health Organization are currently going through is a major challenge for all of us. Switzerland would like to thank WHO for its commitment, its untiring commitment to tackle the pandemic. Switzerland would also like to express her warmest gratitude towards healthcare workers. They have shown unswerving dedication and courage in every corner of the world. Director General, in these very special, particular circumstances, let me assure you of the full and total support of Switzerland to the World Health Organization. Our commitment to you is based on support for multilateralism, solidarity, and international cooperation. Today, more than ever, these things are absolutely essential, and they need to be strengthened. What they do not need is to be undermined. That's why Switzerland is working to set up a coalition of countries, each of which will represent a region of the world. The purpose of this is to guarantee global universal health security with the WHO at the core of that. We need to overcome what divides and separates us in order to protect our people better. If we are to do that, we need to carry out a thorough analysis of the measures taken in and by different countries in order to strengthen the international health regulations, and what we will do in the future. In the past, WHO has been able to learn lessons from the epidemics which the organization has had to deal with. I am convinced that the organization will also be able to carry out a thorough and a critical review of the current crisis in order to improve its future health emergency management. For the moment, however, we must focus on managing this current crisis. WHO needs to learn from the experiences which individual countries have had, but at the same time, she must act autonomously and in a very proactive way in order to cope with health emergencies. At the same time, it's equally important to ensure that the organization has financial room for maneuver. Yet, at the moment, the organization is being funded to the tune of almost 80% of its total contributions by voluntary contributions. I think we have to ask the question, is it reasonable and is it right to demand so much from the organization and yet contribute to it in such a hit-and-miss manner? This current crisis has shown how crucial it is to have a strong, effective and universal organization which can be committed over the long term. If it is to be committed over the long term, however, it must have sustainable financing, which will enable it to independently guarantee and provide its expertise now and in the future. Director General, as we go through this crisis, be assured that you have Switzerland's full support and cooperation. All of us as member states of the World Health Organization need to be focusing on saving lives, protecting the health of our people, and providing health care to those who are sick. We can do that, but we will do it only if we act together, pooling our strength in an international framework that provided by the World Health Organization. Thank you.
Je vous remercie.
Thank you very much, Your Excellency. The Secretary General of the United Nations, Mr. Antonio Gutierrez, has been good enough to be with us today as well. Your Excellency, the floor is yours.
Excellency, ladies and gentlemen, dear colleagues, thank you for this opportunity to address you on the greatest challenge of our age. The COVID-19 pandemic has demonstrated our global fragility. Despite the enormous scientific and technological advances of recent decades, a microscopic virus has brought us to our knees. We do not yet know how to eradicate, treat, or vaccinate against COVID-19. And we have no clear idea when we will be able to do these things. But the fragility exposed by the virus is not limited to our health systems. It affects all areas of our world and our institutions. The fragility of coordinated global efforts is highlighted by our failed response to the climate crisis. The fragility of our nuclear disarmament regime is shown by the ever-increasing risk of proliferation. The fragility of our web protocols is laid bare by constant breaches in cybersecurity, as cyber warfare is also already happening in a lawless international environment. COVID-19 must be a wake-up call. It is time for an end of this hubris. Our deep feelings of powerlessness must lead to greater humility. Deadly global threats require a new unity and solidarity. Excellences, Mesdames et Messieurs.
Your Excellencies, ladies and gentlemen, dear friends. We've heard a lot of expressions about solidarity, but we haven't seen very much unity in our response to COVID-19. Countries have implemented different strategies, sometimes contradictory strategies, and all of us are now paying the price for that. Many countries ignored the recommendations of the World Health Organization. Consequently, the virus has spread across the world and it's now heading for developing countries, and there its effects will be even more devastating than in the developed nations. We see an increasing risk of new peaks, new waves of infection. Since the beginning of the pandemic, the United Nations and I have been pleading for a three-stage response. First of all, a complete, full, coordinated, large-scale health response led by the WHO, emphasizing solidarity with developing countries. We need to unite our efforts to assist the most vulnerable countries and strengthen and develop further their health systems. We also have to accompany that with humanitarian measures. There is an increasingly urgent need to invest in the expansion of mental health services as well, so as to tackle the devastating psychological impact of the crisis. We have people who are grieving, who are anxious, who are depressed, who are afraid of the future, and they must be helped. We also need measures to tackle the economic and social effects of the crisis. And here, let me be crystal clear. This is not a choice between responding to the health consequences of the pandemic or responding to its economic and social consequences. We can't divide things like that. If we do not control the spread of the virus, the economy will never recover. So as we're taking health measures, we also need to take direct measures to support households and businesses and help them stay afloat. We need to focus on the most vulnerable: women, children, elderly people, the low-paid, and other vulnerable groups. That's why I have urged the G20 to look with urgency at a recovery plan which will be large-scale and which will cover at least 10% of the world's GDP. Developed countries may be able to manage this themselves, but we must give a massive increase in the resources available to support developing countries. I've also urged a strengthening of the support provided through the World Bank Group, the IMF, and other international financial institutions. Thirdly, post-COVID-19 recovery must create fairer, more inclusive, and more egalitarian economies and stronger and more resilient societies. Yes, this pandemic is an absolute tragedy, but our response to it and our reconstruction afterwards needs to put human rights at the center of whatever we do. At the same time, we must take this opportunity to tackle the climate crisis, which is still there, and to fight against inequalities, as well as to plug the yawning gaps in our social protection systems. We have an opportunity to rebuild, but to rebuild something better than we had before. By focusing on the most vulnerable, we want to make sure that we have greater inclusivity, more clean energy, stronger social security systems, and all that through expanded and preferably universal health coverage. All that requires a major multilateral effort. I hope that the finding of a vaccine against this coronavirus will be a starting point, but it can only be that. We have a historic opportunity here to step up research and to reduce the inequalities in access to medical treatment and medical care. It is essential that everybody in this world, wherever he or she may be, is able to have access to medical care, and particularly if and when we get a vaccine, to that which will be a global public good. We can do that. We must do that.
Tribute to the frontline health workers who are the heroes of this pandemic. From nurses, doctors, and midwives to technicians and administrators, millions of healthcare workers are putting themselves in harm's way every day to protect us. We owe them our deepest appreciation and solidarity. The entire United Nations family stands with the thousands of our colleagues of the World Health Organization who are working around the world to support member states in saving lives and protecting the vulnerable with guidance, training, and essential testing, treatment, and protective equipment. We thank you for your service. I saw the courage and determination of WHO personnel working to end the Ebola outbreak in the Democratic Republic of the Congo when I visited last year. It is partly or largely thanks to their efforts in very difficult and dangerous conditions that new infections have been contained, and we are counting down to the end of the Ebola outbreak. The WHO is irreplaceable. It needs enhanced resources, particularly to provide support to developing countries, which must be our greatest concern. We are as strong as the weakest health systems. Protecting the developing world is not a matter of charity or generosity, but a question of enlightened self-interest. The global north cannot defeat COVID-19 unless the global south defeats it at the same time. As I said last month, and I quote, "Once we have finally turned the page on this epidemic, there must be a time to look back fully to understand how such a disease emerged and spread its devastation so quickly across the globe, and how all those involved reacted to the crisis. The lessons learned will be essential to effectively address similar challenges as they may arise in the future. But now is not that time. Now it's a time for unity, for the international community to work together in solidarity to stop this virus and its shattering consequences. End of quote. We cannot contemplate a future of fear and insecurity. Either we get through this pandemic together or we fail. Either we stand together or we fall apart. Thank you.
Thank you, Excellency. I shall now invite the President of South Africa and current Chairperson of the African Union, His Excellency President Matamela Cyril Ramaphosa, to make his statement.
Thank you so much, guys, for staying tuned. Thank you for watching my video, and also don't forget to like, share, comment, and subscribe. Give this video a thumbs up if you like it, and don't forget, give it a thumbs down if you don't, but a thumbs up. Thank you so much, guys. I promise to be back with more videos. Till we meet again, it's still a Yamo Queen series. Peace.